Hopkins University about the use of hexamethyl bromide. And unfortunately, Alan Rush, a healthy 24-year-old volunteer, died just because the chemical she inhaled led to the progressive failure of her lung and kidneys. Why was that done? Because there was no proper research done about that. If a librarian was on board, proper research or effective research would have been done right, and the death would have been prevented. Another story about the fake news is Harvard, Brigham, and Women's Hospital seek retraction of 31 articles with falsified data. Even in doing the experiments, we do have falsified data. Another why you should be listening to a librarian, because we think that we are apt and satisfied. Why we know how to research. We are born in the technological era, especially the 90s and the 2000s generation. I've been born in the 80s, so I've been in both the non-electronic and the digital era. But tell you something, before I worked in Saab Medical Library and before I attended one of the sessions with Ms. Aida Farha, my mentor, I used to think that I know how to do research, and I used to have some people for me to help around with the research. But when I attended one of her sessions, I was like, bummer, I know nothing. But it was good. I was teaching them about non-reference library, non-medical or non-health sciences databases. So I was fine. But when I knew how to look up this information, I really knew that I was inapt and satisfied, like the majority of us are. It is no longer your job to know everything in your chosen specialty, but it is your job to know how to find information, how to be health information literate. We have two types of medical questions, a background question and a foreground question. A background question is usually tackling general, the 5 W questions: how, where, when was this disease captured, how was it transmitted. We usually get the resources of it from book chapters. The advanced search becomes a foreground question. For example, if we talk about coronavirus in general, it's a background question. How is it transmitted? Where did it come from? So on and so forth. But when we combine coronavirus in Lebanon, so when we have at least 2 concepts together, now we're looking into a foreground question. We're moving from a novice searcher to an expert searcher. Where do we get the information of the foreground questions from? Peer-reviewed journal articles. Definitely in the peer-reviewed journal articles, you would have background questions, especially in the introduction, because you're going to be defining what is the disease, what is the drug, but mainly you're going to have at least 2 concepts combined together. How to look up literature? As I mentioned, database. What's a database? A database can be a set of statistics together, a set of journals together, a set of journals, books, manuscripts, guidelines together. It can be like a palm tree. You only have the trunk and the leaves that are similar. It can be like an olive tree. You have the trunk, branches, leaves, the olive. Yeah, when you're talking about a journal society database, it can be like a palm tree. A journal by itself, like Jove, Journal of Visualization Experiment, is by itself a database. Also, it can be a database. It is processed data, analyzed data to become information with different contents according to different users, targeted to different users. However, we have 2 types of meshes, of databases. I hope this is clear. I have a keyword database. This is not clear. I'll show it to you clearer. It's not clear though. Better? No, at all. Keyword database and it didn't convert, it's reverted. Okay, so let's ditch the Blackboard thing. So we have 2 types of databases, a mesh database or a controlled vocab database and a keyword database. What's the difference between any? The mesh database collects for me articles that are talking about or indexing. What do I mean by that? When an indexer from, let's say, the National Institute of Health, National Library of Medicine, PubMed, gets an article that has a concept which is cancer, and another article, the same concept, however, cancer is called neoplasm in the other article. A third article, malignant. A fourth article, tumor, American. A fifth article, tumor, British. All of them tackle one concept, which is cancer. So it's as if we're doing a hashtag thing. The indexer sat and thought, how could I inform all the researchers around the world what are these articles talking about and not mentioning? That's the difference between the silly, dumb, irrelevant keyword searching versus the relevant, smart, efficient. You're doing effectively and in timely manner your right research when you're tackling mesh databases. The mesh is the controlled vocab. So the researchers has decided whatever you get, any article that's talking about the concept cancer with any of the synonyms set, the mesh or the controlled vocab or the medical subject heading is going to be neoplasms in PubMed. For example, I'm talking like some example from my mind. In PubMed, breast cancer, the mesh breast cancer or the controlled vocabulary breast cancer is written breast neoplasms. In another medical database, it might be called neoplasms, breast. It's just the tagging of the article, what it is indexed or talking about. Versus when you do mentioning, you're mentioning it anywhere and it's just mentioning. Does it mean it's talking about? No, it doesn't. One other very nice feature, as you can see in the picture here, I have the explosion. It's the wow of the medical databases. It's the explode. What do I mean by explode? As you can see down here, myocardial infarction, and I have many other meshes or medical information, medical subject headings underneath it, narrower to it. The explode allows me to take all the articles that are talking about myocardial infarction or talking about any of the narrower measures without me coming and selecting them. Imagine you doing this for cancer. You'd have, if you do it on Google, you have to go cancer or neoplasm or neoplasmic or malignant or tumor. You have to key in these synonyms and you will get irrelevant results mentioning, you will get the horoscope cancer. But when you do it in PubMed, when you type in cancer, you will be automatically mapped to the mesh neoplasm, which will allow you to explode or not explode the mesh. Take everything underneath it, leukemia, breast cancer, prostate, lung cancer, so on and so forth. So that's the wow of the medical databases. You don't have to come and click and search. Where do the medical databases or the controlled vocab databases, we're talking about medical databases, controlled vocab, because there are other controlled vocab databases that are non-medical. The medical ones, they search in the bibliography. What do I mean by the bibliography? The citation, which is the journal's name, article's name, author's address, volume, issue, page, year, DOI, PMID, abstract, and the subject headings, the keywords of the authors written as well. So we've explained what's a controlled vocab and what are the features of the bibliographic medical databases. I'd like to resemble this analogy into something. Let me open Paint, that will be better.
You can also use the whiteboard feature, Layal, on Zoom, whichever you prefer.
So if I want to make this a closer look to you, the mesh tree and the explode tree, I like to do the analogy of Instagram. So I have father, my father, I have me, and I have my daughter. You can see that the narrower the mesh, the narrower the indentation. So this is level 1, this is level 2, and this is level 3. My father has 10 Instagram followers. I have 100 Instagram followers, and my daughter, which is the tiniest, the youngest, has 200. She has more than us. It doesn't mean that this number is the summation of any of the below. No, this number only gives us the Instagram followers of my father. or when I say it in mesh tree, it's the articles that are talking about father only, full stop. When I do the exploding, I'm getting the articles that are talking about my father, that are talking about me, and that are talking about my daughter. So I'm getting, instead of 10 results, I'm getting 100 plus 10 plus 200, 310 articles rather than one. And I don't have to come and select Layal and Leah. It does it by default when it does it when you only select explode, the wow of the medical databases. Leah, however, there is nothing underneath her, so it doesn't matter whether I exploded Leah or not. But would Leah's number Instagram followers change if she were in the other tree, which is underneath her father? What do you think? No. This number doesn't change no matter in which mesh tree you are. So for example, MMR might come under measles, might come under rubella, might come under mumps. The number of articles that are talking about MMR would not change no matter which tree you are in. What would change is the ability of you to select either Layal or Leah's father over it. Okay? So this is the mesh tree talking about the mesh, the controlled vocab, rather than the keyword, which is the dumb city search. Let's search now on PubMed something. But first, let's introduce what is PubMed. It's a bibliographic database. As I mentioned, you can look into the citation, abstract, subject headings, dating back to early 1900s indexes. It has around 5,700 international journals. It's a free resource, so use it in an efficient way, effective way. It is like Google. So most people think, if I look into PubMed, everything will be la vie en rose. So let's, for example, look in PubMed. This is the new PubMed. We're gonna be looking into both, okay? Let's first search, no, I have it as a Kahoot. Let's search breast cancer here. So breast cancer, this is what I've done, khalas, I'm okay, I'm fine. I don't go about checking whether it was mapped to the right mesh or no. Always, 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 when you wanna do effective searching, come and check under the search details whether the concept has been mapped to the right mesh. And yes, it was. Then I'm fine at this stage. If it's not, then I have to come and think it over. An example will be really soon. Okay, you will tell me, what about the other ones? Breast old field, neoplasm old field. Why is that? Because in PubMed, I have two types of people working. People who enter the data and people who index the data. There's a gap. How long is this gap? It depends on the quality of the journal. So if we have Lebanese Medical Journal, when it was indexed in PubMed, unfortunately, it's no longer there. It wouldn't take it like 2 days for it to be indexed, the articles in it, when it's published. It would take forever, probably. But if I have New England Journal of Medicine, probably within hours, I would have it indexed. So PubMed always maps me to the mesh when it finds it and ORs it with the other keywords to account for this gap, the data entry and the indexing. When I do this in Google, what would I get? First of all, mentioning, I typed it wrong. Other than mentioning, what would I get? Breast and cancer. So I might get breast in the as the first word in the title and cancer as the last word in the references. It doesn't search for me the bibliography when it searches for me. It might search a blog, it might search the whole journal. And it is searching as mentioning. If I want to make it a little bit better, I would use quotations to look as a phrase. So breast cancer as a phrase. Still, I'm looking for mentioning and I'm not looking for talking about. That's the difference between PubMed and Google. Let's look into more differences. What is Google Scholar is a good way of searching. However, it is still mentioning. It's familiar to Google interface like PubMed is, and all the doctors are used to it. It's very broad coverage. It's integration of citation information and author. It has how many times the article has been cited, so on and so forth. And the results can be linked to the library collection. And if you have an article, you can see whether your library has it or not as a full text. What about some cons? The search string is not broad enough, and you cannot like do, for example, breast cancer as first step and then do Lebanon as second step and combine together. No, you have to do it in one string. Plus, it's not clear how scholarly is defined. There's no way telling us how would it interpret things. When you want to do Google searching, try to use these tips. So the Boolean, if I don't type in a phrase, between two words, it's an and. So if I type breast cancer without putting the phrase, I'm looking for breast and cancer. So you have to put an or for it to understand. There is a application. So if you means infant star mortality, I have one word maximum coming between infant and mortality. This is a truncation, which is a good thing. If I want to make my breast cancer even better, I would put site.:nh without any spaces.gov. So I'm looking for this phrase in a specific site. I tried here multiple of searches on Tuesday. All in title means I want all of these words. So coronavirus and Lebanon, I want them both of them to be in the title. I got 13,300 results. All in title coronavirus Lebanon, plus I added to it, I want them to be in the site.org. I got 1,160. Similarly, I want coronavirus Lebanon and the sites.lb. So I played around with Google in a way that made it proper, more smarter. It doesn't mean that I'm looking for talking about, I'm still looking for mentioning. However, mentioned in organizational sites and government sites, in the title. So if it's in the title, so it's more or less talking about this thing. Whenever you have anything on mind, always, always, always type in whatever you're thinking of and next to it LibGuides. They are a culmination or a hub of whatever has been collected from databases, journals, ebooks, guides on how to talk about or use specific things. So if you go into fingerprints, for example, fingerprints LibGuides, you will find things about fingerprints. If you will go to EndNote LibGuides, which I've created one for you, which is a citation management tool, you will find ways on how to export from different databases into EndNote, the features of EndNote. Why do we have to use it? Why is it important? Which I'm going to be discussing towards the end of this webinar. So the difference between PubMed and Google Scholar: PubMed searches only bibliographic data and medical subject headings, the controlled vocab, versus Google Scholar searches in addition to that the article in full text. We have the talking about indexing mesh versus the no controlled vocab, the keyword searching, the silly dumb. Provides search history, so you can combine different steps at a time. No search history, one at a time. I have a query limited to 256 characters. So if I have a long search strategy, you can use, for example, instead of or, which is space or space, this thing on the keyboard, which resembles the or. If you have an and, you can ditch it because the space is an and. These are some tips if you have a long string. You can limit the number of fields in PubMed, but can limit the search to title and author fields only. In PubMed, you can go into the publication type, into the years, into the age, into the gender. Has a large selection of predefined limiting options, but none for humans age group and what I just mentioned. You can download a number of records directly to a citation management tools in PubMed versus in Google Scholar. You can add them to my library when you're signed in into your Gmail or Google Scholar account, and then export the whole library into EndNote, or you can add it one at a time. Sorry, the electricity went off. How do I go about the foreground question? If I have, say, a question which is of two concepts at a time, I should break down each concept, look for each concept for its mesh. As we mentioned, we're talking about effective and timely manner searching. And then we combine the two concepts after looking for their meshes with Boolean operators. I have 3 Boolean operators: and, or, and not. And is command or the intersection in math when we do the Venn diagram, or is more, and not is hot, not as in hot as in sexy, no, hot as in it burns our fingers when we do it. Let's take an example. If I'm doing pregnancy and hypertension, or hypertension in pregnancy. I have two concepts. I have to combine them. I want the articles that are talking about both pregnancy and hypertension to show for me, talking about so meshing. So and is the Boolean operator I use. What if I didn't find enough results from hypertension? I would be adding hypertension and high blood pressure. How would I go about it? Hypertension alone, high blood pressure alone, and the intersection between them both is provided to me by the or. Or is more. What if I'm talking about hypertension not in females, but I'm too lazy to do hypertension alone as a mesh and females alone as a mesh? I'm too lazy, so I did hypertension not males. This is fine, no? I'm gonna get all the articles that are talking about hypertension not males. No, why not? Because I would be missing the articles that are talking about hypertension in both males and females. That's why, like the smart student and the intelligent student, I have to do hypertension again and females again to combine them. What if I have a mixture of Boolean operators? So if I'm talking about pregnancy and hypertension or high blood pressure, we have to include the brackets or the nesting. I'm not the software engineer. I don't know how the database functions. So probably it would get for me pregnancy and hypertension before it does or the whole concept with high blood pressure. That's why I have to combine the concepts together. Let's do some Kahooting. Please go to kahoot.it and plug in this, where is it? Pin. It's a quick game, just for you as a refresher to what we are doing. Plus, I need you to go to PubMed as well. To go, the last question is gonna be about PubMed. So go to kahoot.it, Kahoot, Kahoot.it, and plug in the game pin, 11537. Are you there? Are you there? Okay. I'm gonna have at least 5 players to start to save on time. TT, apps, Marielle, okay, one more. And we're gonna start, you can always join. Can you please send me this PowerPoint to my email? Yes, I can by the end of this. Yes, because it has links in it, so don't worry about it. Okay, I'm gonna start. You can always join by adding this pin. It's gonna show here. Okay, let's start. You're tested on time as well. Okay. Let me show why is this not unmute. So should children with eczema be treated with antibiotics? What type of question is that? The foreground question, I'm combining at least 2 concepts together. So it's children with eczema treated with antibiotics and not treated with antibiotics. Actually, it's a PICO question. It's an EBM. It's a higher level of even searching. Let's continue. RH is the winner so far. How is hepatitis transmitted? What type of question is that? There are more than 5 people apparently, because when just 5, it would have stopped. Background question, I'm discussing the 5 W's. How it's transmission. It's a general question. I'm not combining 2 concepts together. And usually the how, the epidemiology, the prevention, the therapy, I can find these into another feature into the MeSH databases as well, called the subheading. I'm not gonna go to the further features like the subheadings and the focus. It's enough for this time being as explode. Let's understand it, and that's more than enough. Next. The best way to research women who are pregnant and have diabetes is? diabetes and pregnancy. They're staying on words. TT is on fire. What is the search strategy to look up the target population of pregnant, whether they're diabetic or not diabetic? Like Aladdin's music. Et voila. Or excellent students. The last one, no, let's skip it. Back. Oh, no, cancel, we can't do it. If you're allergic to either peanuts or eggs, how would you construct a search strategy to look up your case? Excellent job. Okay, let's continue further with our slide. So let's search PubMed, does MMR cause autism? So I have two concepts. How would I go about it in PubMed? Here, I'm gonna search it using the old PubMed once and the new PubMed once to show you what's the difference. So MMR and autism, I have two concepts. I can ditch the and because the default Boolean in PubMed as well is and. So let me see. I always come into the search details, as I told you. Search details supposedly is here because the internet connection is unstable. You cannot find it. Let me do it again. And let's do it here. MMR and autism. So as you can see, MMR was not linked to the mesh. It doesn't understand abbreviations all the time. That's why I tell you, please, make sure to go to the search details in PubMed. How can I fix that? I can either type in vaccine next to it, or I can simply write measles, mumps, rubella. Again, wow, I got a big number. It doesn't mean that I did it right. I always have to come and check whether it was mapped to the right mesh, and yes, it is. One way is this way. Another way would be going back to the regular PubMed, going to the mesh database. So I can search MMR, break down the topic into concepts, search each concept alone. So this is it. If I click on it, I would go into the subheadings, which I told you about, and into the mesh tree. So it's the last in the mesh tree. I add it to the search builder. Then I look up the other concept, which is autism. This way, I'm removing the O-ring with the keywords in the regular PubMed. I'm only looking up meshes alone. So autistic disorder, since I know I want it, I add it to the search builder, and then I search PubMed. Voila, instead of 600 something it was, now it's 389. So I ditched the or with the keywords. Here, when I did MMR and autism, where's the search details in the new PubMed version? You'll have to go to advanced and then click underneath the details to see whether it was mapped or not. Unfortunately, more steps are added. Okay, but you can always come to the mesh tree here and do with each concept alone and then combine using the proper Boolean operator. How about doing cocaine? Does cocaine cause heart attack? So I'm gonna simply type in cocaine. No need for an and, or you can add it, it doesn't matter. And heart attack. I go to the advanced, and then I click under the details. See, I have search strategy number 1, number 2, so I can combine different concepts together. And cocaine is mapped to the right mesh, right? And myocardial infarction. So heart attack, it automatically mapped it to myocardial infarction. See how smart PubMed is versus Google, yet you have to always come and check because it wasn't so smart here in MMR and autism, okay? But what about cocaine cracking, cocaine smoking? So if I type in cocaine as a mesh, here, I'm exposed to more meshes than the one that is mapped already. So I can choose more meshes to OR them with one concept. Okay, let's go into Kahoot one last time, and you have to use your PubMed as well to answer this. What if I'm looking for the concept brain CT? Would it be like me looking into breast cancer? How many answers would I get? Whoa. If I'm looking at brain CT, I'm getting 5 results. Why? It mapped me to the author. It gives you the family name and the initials. So it happens to be, I have an author named Brain CT. How do I fix this? I put brain and CT this time. Let me see. It didn't understand that there is an and by default. So let me check. When I do the following, now I am on the right track. Again, no, I cannot say I got so much results, yani fine. I have to always come check for the search details. Brain was mapped to the right mesh. However, CT, again, is not mapped to the right mesh. It didn't understand the abbreviation. I have to come and write it again, brain and computed tomography for it to understand it. Wow, enough results again? No, I have to come and check the search details. So brain is mapped and computed tomography is mapped. Now I'm doing it right. We can ditch the ORs with the keywords by going to the mesh database directly, okay? Beyond PubMed, SML provides a service for all AUB and non-AUB users, the doctors mainly and public health practitioners, that we can register you directly into receiving into your email weekly the clinically significant secondary form paper and summed up and reviewed papers in your chosen specialty. You only have to come to the link and register. As for the nurses and public health practitioners, you'll have to do it yourselves. Other sources to EBM is EBM Journal Dynamed. It's a very nice resource as well. Medlineplus.gov, an informed patient is a better patient. You guys, when I was doing my master's in Pittsburgh, I had an episode of bladder. I didn't know it's bladder. When you're healthy, you don't think of things. Like this episode used to continuously or frequently happen to me. Then I was like, oh, I teach people how to use medlineplus.gov, a reliable resource. Why don't I go and use it? It's a layman language database done for patients, for them to go and check the symptoms they have, to know what sort of disease they might have. So instead of going and searching Google, this is a reliable source done by the National Institute of Health for you. And it has some Arabic translated manuscripts. Choosing wisely, you guys. I have to emphasize on this. If you have a pylori patient and they are pediatrics, peds. Where are you, the peds? Again, the age is pediatric. The setting, I don't want it to be except outpatient, and I don't want to choose. Choosing wisely gives you a recommendation on what to do and what not to do in this era of overdose practice. I don't want overdose practice. I don't want to embark my patients with doing tests and examinations and so on and so forth. This would tell me what to do and what not to do, which is very nice. It saves costs on the hospital administration itself, on patients, satisfied patients. They come back again to you. So this is a very nice tool for the practitioners. Beyond PubMed, there are these links also. These are guidelines. They are free. All of what's mentioned here are free databases. Zotero is another citation management tool other than EndNote, which we buy. AB has so many resources, so we buy many of Scopus. We buy Scopus and Web of Science. These are citation analysis tools. Of the citation management tools, we buy both Reference and EndNote. If you don't have, we can share the EndNote library with Zotero. What's the importance of Zotero, EndNote, or any citation management tool? When you do your work and have your references in a hub, which is the you will have your citations done for you in text and in the references simultaneously. Plus, for example, you submitted your manuscript to a paper and you weren't accepted, you will be able to update or change the style into the other journal that you will be resubmitting to without you doing the work manually. So back again to the question, why listening to a librarian? Well, if you're still confused, well, that's just a sample of what I can help you with. I can go along with you in advanced searching. Again, we discussed only the very basics, which is one feature of the medical databases, bibliographic databases. We can go one-on-one consultations. I can be embedded in your courses. I can give workshops, webinars, perform and teach you how to go about systematic reviews and scoping reviews, where to publish. We had attending lose his patent for a predatory journal, which is a fake journal. Please, guys, consult with us before you submit your journal, your article to publication. Finding and providing articles, book chapters, books, more about drug information, how do they interact with each other, guidelines, calculators, how to use any citation management tool, how to boost your research, to have a better H-index, to have a Publon, ResearchGate, ORCID, have your name written in a certain way, and so much more. So remember, even if this is just the beginning, stay calm and always ask a librarian.
Thank you, Layal. That was wonderful. Very interactive and interesting. I think we can open it up now for questions from the audience. If you'd like to talk, you can just click on the hand icon in the participants list next to your name, and then I will unmute you. Otherwise, feel free to write your question in the chat, or you can write your question in the Q&A.
How can I answer? So Baker Halawi, yes, you're most welcome anytime. This is just the beginning. When you want me to give you more sessions, we can go more advanced. I have a couple of LibGuides and I have a YouTube channel, I forget to mention about that, on how to use different databases, bibliographic databases, thoroughly. What else? Any more questions? Abbas Aluta, hello, thank you for the great presentation. My colleagues and I are planning our systematic review. Do you interest? Of course, I would be interested to join you. I'm always interested. How can I answer here? It's just live? Okay.
You can type an answer as well.
I know, I cannot, apparently.
Okay. Do you want me to ask them for their contact?
Yes, sure.
Okay.
Yeah, they can have my contact, actually. It's towards the end. Let me open the PowerPoint again. This is my contact information. Any more questions? Thank you for the great reply. Yes.
Okay, we
My
have
email.
one anonymous question. Is PubMed enough to search for medical information?
It depends on the researcher. If you feel satisfied with what you have results, then if you do it in the right way, it would be fine, especially if you're doing a literature review. But when you're going about systematic and scoping review, definitely it's not enough.
Okay, and then there's another question from Jed Ferry.
And how you access the specialized clinician search for Medline Plus. Medlineplus.gov. It's not meant for physicians. It's meant more for patients. For them, when they have interviews with their doctors, to know what are the answers, would you usually search? What? Okay, maybe which? Abbas. Usually I go Medline, Ovid along with PubMed because they're interchangeably, and PubMed is 2% more than Medline, Ovid, Embase, Sina, Cochrane, the utmost Embase, and it depends if you're talking about, let's say, EMRO region or Arab region, then I go Global Index Medicus along with it. We can add gray literature to it. What happened to the PubMed Labs project? Did they step down? No, it was called PubMed Labs, and now it's the PubMed that I showed you, the new interface, which doesn't have the search details to the right, but it has it underneath the advanced and then details. Okay. This is done. Type answer. How can I type answer? Okay, is PubMed enough to search medical information? I already answered this. Again, no researcher does his or her search the same way. You have to make sure of this. There's no right and wrong except for the basics. Yeah. Now we know what's a mesh. So we're supposed to be looking for mesh. It doesn't mean that all the concepts in the world do have meshes. That's advanced. We can go into this in another probably workshop. Thank you for the presentation. Can you show us again how? medlineplus.gov. Okay. Does he mean medlineplus.gov or the choosing wisely? Clinicians list is the choosing wisely. You mean choosing wisely? So if I go, I will get the PowerPoint has the link already. So if you're looking for a specific disease on how to treat somebody with pylori, or what are the recommended tests, procedures, pathology, medications, lab, and imaging, we have it done by the ABIM across different societies. You choose the topic area, the age, and whether you want the patient coming to you as an outpatient or an inpatient, and simply click search. It will give you the recommendation where you can click on it and read more. I answered Jad. Great, then maybe which database, and I answered Abbas. Medline, Embase, Cochrane. If you're doing a nursing, I would rather do, or a topic about nursing, I'd rather do SINA. There is Social Services Index, gray literature, so on and so forth.
We also have a new question from Abbas in the Q&A.
Send. Which do you,
it's a new one. What about journals that do not require keywords to be mesh terms, even many important journals?
What about journals that do not require key terms to be mesh terms? Even many important journals do not require that. Keywords, yeah, that's one thing. The keywords set by the authors are not meshes all the time. And yeah, they don't require. Who said if you do a systematic review, everybody does it properly? Even in the most prestigious journals, it doesn't mean that the search strategy is done really well. The editors wouldn't be looking so. I prefer when you submit the manuscript to have the keywords that you set are the meshes. But if you don't, it's not a must do. But when you're doing your literature search to find information from across, yes, you have to do mesh searching because you want to get articles that are talking about. Remember the cost of finding so much information? When you do the keyword searching, you're getting non-relevant, dumb searching, mentioning, versus when you're doing the mesh, you're doing the right, proper, efficient way. It's my name. You can just go to YouTube and then my name, so. I can do this. I cannot answer. What's the name of the YouTube channel, the anonymous person?
I can send it to them.
Okay, so this is the, simply just type in YouTube and my name. Okay. What about you? Okay, we answered this. Okay, again, we answered this, so yeah. Is it the same? Or we'll give you the same as this one? Okay. No, it's not the same. Habiba.
Okay. Okay. Let me open it up on my computer.
So it's this one, copy. Okay, I can answer it here. No, it's not done. Sorry, I answered it as done.
You can
Not
send it in
answered.
the chat as well.
Send.
There you go.
Where is the chat? I messed up with the Q&A now and the chat.
Here, I'll send it to everyone.
Chat.
All right.
Can you please send me the yeah, we're gonna. Do you want me to send the PowerPoint here on the chat?
Ala and I can send it as a follow-up to everyone. We'll also, this is recorded, so we will be archiving the webinar on the AHCI general website as well as the AHCI MENA website. So everyone will have access to this later on.
Okay, perfect, perfect. Any further questions, you guys? It was a pleasure having you. I was so happy to give this. And remember, stay calm and ask a librarian. I always tell my users, whatever you want, even if it's just a sharpener, just knock in. You never know what services would I be giving. And by the way, I have a couch for a nap for the residents who have overnights and so on and so forth. Yes, they can come and have a nap at my office when I don't have consultations, that is. So if you're
Thank you so much.
you're welcome.
Thank you, Layal, and thank you everyone for participating.
Stay safe, you guys. Stay home.
Yes. All right.
Bye.
Bye-bye. Take care, everyone.
Bye.